Being a healthcare professional is definitely not a desk job. The ability to retrieve information on the fly about both patients and critical medical equipment is imperative. But with this access comes concern about network reliability, design, and security, which is where the Cisco channel steps in. We spoke with several Cisco partners recently about the implications of mobile and wireless technology for healthcare solutions and their view on this growing opportunity.
Basically, what the mobility solutions for healthcare does is they provide the secure wireless foundation, which is really your extension of your medical grade network over the wireless network. We want to provide access to the point of care for applications for the end users or the mobile care professionals. And as we provide access, we also want to integrate it with unified communications over the wireless network to enable collaboration and streamlining of the clinical workflow over the wireless network. So some of the solutions that we are working with today will show some of the devices that have been certified on our wireless network. The reason we certify devices, whether they be medical devices, dual mode phones, mobile clinical assistants, is that they interoperate with the network. They have been tested to roam effectively on the network. So when healthcare providers are implementing the solution, we have a completely end-to-end tested solution. So what we are showing here today are some of the mobile clinical assistants that have been certified on the wireless network. And they will be using personal communicator as well as unified personal communicator to share high bandwidth images and information at the point of care. We will also be using the 802.11n network, which is the next generation standard. The reason that this is important is because we have developed a specific technology to increase the performance of existing as well as end clients on the 802.11n network. Some of the challenges is, first of all, to get access to the information, and the second part is that the RF environment or the wireless environment is often challenging. You have interference from microwave, Bluetooth. So what we are really doing is we have a host of troubleshooting tools that allow you to identify those interferences in the wireless network so you can optimize the performance and minimize the interference in the network. It helps them collaborate more effectively, provide better patient care, and it helps them reduce cost by leveraging their existing wireless network for mobile communications as well as for data access.
This gets to, first of all, the overall improvement of the quality of care. So patients now don't need to wait for equipment. If there's a need for a certain medical device, you don't need to search for it on the floor or in other floors. So you're reducing the wait times. The satisfaction of the staff increases because staff doesn't now need to do all these manual searches for assets and devices. In addition, all sorts of tasks that they had to do on a daily basis, like monitoring the temperature levels in refrigerators, they don't need to do anymore. All that is automated. Imagine a typical hospital has anywhere between 200 to 500 refrigerators and freezers. Nurses in lab and pharmacy need to go every day, depending on what's stored in the refrigerator, 2 to 4 times a day, open the refrigerator, read the temperature range, the temperature level, write it down, log it, and do a corrective action if needed. All this is automated, so we're now freeing up the caregiver's time to actually give care and not do those daily routines that they were used to. Integration actually is a key component of our solution, and we find that whenever there are integrations involved, it's very good because then it means that it's actually embedded in the daily routine of the user, whether it's a nurse, a distribution guy, or a transport guy, or a biomed engineer. As an example would be, you take a Cisco voice over IP phone. So if a biomed engineer now is searching for assets, he's walking in between the floors and he has a mobile device on him that he's carrying. He now wants to be able to conduct a search for a certain asset that he needs to do preventive maintenance on. So he can open up his voice over IP phone and locate that specific asset and know where it is. So there's a lot of time that's being saved here and efficiency.
Cisco partner AnyTeam, which has worked on dozens of wireless healthcare networks, classifies the most important mobile healthcare solutions into the following categories: applications for asset tracking, infrastructure for delivering group alerts and pages throughout a hospital or clinic, and systems for proactive maintenance of medical devices.
One of the most unique things about healthcare in general is it's that wide variety of devices, from small voice badges, Cisco IP phones, you look at PDAs, different types of tablets, computers on wheels, barcode scanners. There's a lot of things going on inside of a healthcare environment, and how clinicians access those applications, right, is going to be based on the needs and the things that they need to do. Physicians may not like to carry a tablet because it might be big and bulky. They may prefer a PDA. Nurses may prefer another device, or maybe something that's mounted against the wall. So we have to take into consideration all those different types of devices, because there's no one brand that fits all, or one device that fits all.
The staff that we've got at NetTeam has some great experience with some large deployments. We are one of 7 Cisco subcontractors in the country. When they want something that's complicated done, they call us, and we get to go do it, which is exciting. Right now we're doing Ohio State Medical Center, for example. It's a couple times a year that we will go into a hospital saying, there's something wrong with our gear. This is not working, that's not working. And we'll go in and look at some wireless that was put in incorrectly. So the gear's working perfectly fine. It was the design that was incorrect. So we're very proud of our engineers, very proud of the knowledge they've got, and they're going to help deploy these wireless initiatives that will be coming as part of that electronic medical records, that kind of thing. I see our play there in the services end more than in the hardware.
To find out more about how you can apply your wireless and mobile solution skills to the healthcare industry, visit the following link to a great podcast on the subject. You can also research more about healthcare and mobility at this link.